Hey guys, Darcy Ninja here. Today I'm focusing on a muscle in your hamstring known as your bicep femoris and how this can contribute to dysfunction in the knee, causing some external rotation of the tibia, so the the bone in the lower limb. So our bicep femoris is our most lateral hamstring, and generally it's the biggest contributor to performance when running, when kicking, and playing sport. So it generally tightens up quicker than the other muscles in our hamstrings, our semimembranosus and our semitendinosus. Let's not get caught up with the names, let's just get into some treatment. So what I want to show you is how I can, the hamstring connects over the back of the knee. So it crosses the knee, it does knee flexion, so that's contracting there, we can see that. What I'm going to do, show you how first of all, the fibula, which is the bone on the outside, can externally rotate this way, causing some issues in our biomechanical movement patterns when we're running and when we're squatting. So what I'm going to do is reverse that and neutralize that movement. So when we do get into the gym, when we do start to run, when we do go back to sport, we have this neutral alignment of our bones and of our muscles. So first of all, I'm pinning that tendon with my palm here, and it's a broad stroke. I'm getting a bit of a palpation going on there where I can identify where the adhesions and where the build-up is. And already Ninj is telling me that there's some tension or some build-up or some soreness in there.
Communication, isn't it?
Yeah, that's communicating with me right there.
Bit of body language.
Just that I'm on a good spot. I don't need to go harder. I don't need to be any firmer.
Just sort of helping myself get through it, a little bit of breathing and little distraction because I want the work. Yeah, just help me get through it a bit easier.
Yeah.
Feels really good though, man. Just really engaged.
Yeah. Sticking to our philosophies, our concepts, going really slow and collecting any debris, collecting any build-up, pushing in and holding the spots, working into the tendons is what we do best, and that has really the most effect in unraveling tension and build-up, especially in this case when we're trying to reverse postures that have been built up over years. If you're playing along from home, I recommend getting your wax, getting water, getting something with a little bit of lubricant other than oil, and just getting your thumb, palpating the lateral part of the knee here, lifting the foot or ankle up, and pinning that tendon just a little higher than right at the back of the knee, just a couple of centimeters up, pin that. Okay, now if we're stuck in external rotation at fibula, we're going to pull it into internal. So I can grab that with my elbow here, I can play with the foot. The foot's a really good key, and I can unravel that there. Now the thumb is going to be pretty sharp and sore. Now, because I used my palm at the start, I already knew that palpation, that I could feel that there was tension right there, and you can see that that really ropey tendon, fibrotic tendon, and you want to sit and balance on that. It is quite ropey, so I'm actually going to get a double thumb there, and this is comfortable enough for you, Ninj.
Yeah.
Other than me pushing in and causing some pain, but my sturdy support here, locking that heel under my armpit, just allows him to relax, and he doesn't have to hold himself up, which can be detrimental to your treatment. So just pinning that, and then look at this, I'm actually just going to lower that leg just like that, and my direction is working up with the tendon, up with the fibers of the tissue. So if you're playing along, we're pinning down, and then we've got a slight angle working up towards the glutes. This is the insertion points of our hamstring, really working that white tendinous fibers. We're going to be hydrating the tissue, getting blood supply into this area, and also having an analgesic effect at ridiculing some of the pain, some of the soreness that you're feeling in there. We're also going to be on top of those hamstring strains, reducing the chance of you straining your hamstrings because there is so much pulling going on in that in that muscle that essentially it gets so tight and the muscle will go on you. So we're elongating the tissue, allowing it to dissolve, soften, and not be so fibrotic. Tense. Oh, there's a good spot.
Yeah.
All right. Okay. So now we're going to start to get a little bit of internal and external rotation of that tibia and fibula, which is a bit of a shimmy move to make sure that we're being really effective. All right. So that's our external rotation. We want to make sure we pull it into internal rotation as well. The next move, if you guys are playing along, get some wax, put it on your forearm and your elbow. We're going to use this part of my elbow. I'm going to soften the tendon like this, pull the foot up, pin, and to begin with, we're just going to hold that, because that's a really good spot. Support that ankle, support that heel, support that lower limb, and then slowly but surely just let that fall down. Good, coming back up, reducing a little bit of pressure, pinning down, going deep.
It's good, man. So therapeutic.
And then letting that drop.
Yeah, you got to experience this.
Yeah, how's it feel, man?
Yeah, amazing. Like, it's just so deep,
Yep.
but you kind of, it's that therapeutic thing, but there's a level of sharpness,
Yeah.
right, when you get a different angle or a different spot that you got to work through, and then not seize up or tighten up or kick you out.
Yep.
I think that's an important thing. You got to experience that to know it.
Yep.
Yeah, if you kind of just breathe and, like I was doing before, just kicking the other foot or whatever it is, tapping your toes. It's like a little distraction that lets the work happen. You're still going to be able to melt and clear the junk in there, but you can kind of distract a little bit and work through it all. You want to breathe and really experience it. Yeah, it's possible as well, but we talk about it a little bit. It's a knowing. You know that it's actually beneficial. It's going to be beneficial in the future once the work's done. It's clearing stuff out so the body can go to work and heal things up.
Yep.
Change.
I'm finished with the active stuff for now. Now I'm just doing like a broad elbow all the way up the tissue. So yeah, I could feel something there. Ninja is quite tight through here. Sprinting, deadlifting, you're gonna build up some tension. Get a little look on that chart as well. Yeah, it's probably that one, isn't it? Of where we're working. Yep. Yeah, that's it. Lateral. Yep, all the way up there. Pretty cool, hey. Yep, and that white stuff you can see on that chart is tendinous. It attaches it all the way on up the femur as well. So, yep. We know our attachment sites are hamstrings are into that ischial tuberosity, right into that sit bone there. They all originate in there, and then they connect in different portions of the lower limb, medial side and lateral side, inside and the outside of the leg. Yeah.
It's good, man. That's good.
Again, make sure you're going slow. We're at a depth where we're almost connecting with the bone, with that leg. So make sure you are going slow so the person can deal with that pain enough, easy enough. There we go, beautiful. All right. So once we've done that, I'm just going to finish with a little bit on the other side of the knee. So if this is the crease of the knee, I'm just going to try and find the head of the fib. So that's the head of the fibula there, the smaller of the two bones, our fib and tib, and we're just going to pin that and just see how we go working that head of the fib where that bicep femoris inserts into. It's not too bad in there. It doesn't feel as bad as it did on the other side of the knee. But playing along, have a little bit of a feel around, palpate the top of that fibula, see what it feels like. Even grab the fibula, and you can see that that's a bit of a joint mode there. You can have a little bit of a play around with, is there a movement in there? That should move, it shouldn't be stuck. If it's stuck, then we know that these, that bicep femoris is so tight that it's pulling on it that there isn't any give. So that would have been a good test to do beforehand, actually. But yeah, there's a good amount of movement in there, which I'm happy with. Cool. So spending a few minutes working that bicep femoris, unlocking that pulling on to stop it, prevent it from externally rotating that fibula, neutralizing that. Now we get into the gym, we make sure that our tracking is correct with our knees. So we don't have knee pain, we don't have hip pain, we don't have ankle pain. It all starts with this bicep femoris. I'll meet you down there. So Das and Ninja, we're in the gym. I'm going to show you the importance of knee tracking when we're in the gym, when we're squatting, when we're lunging, when we're moving. So I've got bones here first to give you guys a little bit of an idea of what happens when we're into knee flexion. So maybe if you come around to the side, Leo. So when our knee comes into flexion, and if we're tight through that bicep femoris, which is attaching onto the head of the fibula, it's going to externally rotate, pulling that knee into a poor biomechanical position, okay? So we're going to cause a lot of jamming on the inside of that knee when that is externally rotated like this, okay? So we've neutralized that muscle. We've now got a femur and a tibia that is neutral. We get into the gym. So I've got this dowel on Ninja here to show you and guide you where the knee needs to track when we're doing lunges, when we're doing squats. So we're looking for it to go over the second and the third toe. We don't want it to go more wider of that or too far inside of that, especially when you're starting out. So Leo, Ninja, if you can go into a lunge and show us, yep, that's a neutral lunge. That looks really good. And then show me what it would look like if it was to fall on the inside. Yep, and you can see that where the direction of that dowel is going, it's way out here. Too far. So too much of that, too much repetition of that. Say we would do 20, 30, 40 lunges in a gym session week after week, we're going to end up with medial knee pain. If we do the opposite to that and go on the outside and there's too much jarring on the outside, again, we're going to end up with lateral knee pain. So that dowel is pointing on the outside of that fifth toe, fifth metatarsal. Also, maybe show us a squat, Ninja. Yep, so that looks really good, doesn't it? That's going straight over the second and third toe, or it should be, hopefully it is. That would be one. We've got a tight bicep femoris. It's pulling us outside. We're going lateral. And then the opposite to that, maybe our semi-mem, the muscle that we didn't focus on is tight, causing that valgus of the knees, knock knees. Look, it's okay in sport. We've seen some really good basketballers, some of the greatest, be able to, have that knee valgus and perform well, but we're not all NBA athletes. We're training you guys in the gym to have good biomechanical patterns and good movement patterns, so we're not causing extra grief or pain on our knees or on our joints. That's cool. So show us that knee, that lunge again, Ninja. When we're running, we're probably going to be. So when we're running, we're probably doing a little mini lunge. So again, if we're running and our knees falling inside, again, we're going to end up with issues in our knees or in our hips. So if you're constantly running and you don't have the stability in that knee, we get into the gym, we train within that plane that we're getting that knee over our second and third toe. We've got strong muscles. We're reluctant now to injuries. Hopefully we don't injure ourselves. And we're ready to play sport. Thanks for watching, guys. Give this a go. Train over second and third toes with our knee and you'll be all right.
Like, subscribe, share. Do our courses, Fix It Yourself, the exercise one, and how to treat. So yeah.
Thanks very much.
Some for everybody. Done.
Forgot about